Prashant, I think you brought up a number of things that I'm very curious about. And I think the biggest one is obviously an area that we have in common, which is, I think, entrepreneurship and supporting startups. What, from your point of view, would somebody with a promising solution have to keep in mind beyond the science if they were to have the kind of success, if they aspire for the kind of success that Qure has had in, I think, the adoption of of their solutions? And where is the support lacking in the system today for them to get?
I think the biggest, support, lack of support, I feel is that Qure, has competitors. So we do TB, COVID, some of these conditions, some of these diseases, which are mostly low and middle income countries, right? But we'd also do stroke, trauma, heart failure, lung cancer, which are global problems, even developing economies. And we provide radiology support, so which is again a global problem. And so for those conditions, our competitors typically are Israeli companies or South Korean companies or countries from the developed economies, right? And what we have seen is typically a lot of those countries get enormous support from their governments, enormous support from their governments. The governments fund them, they promote them, and they get funded to deploy in various parts of the world. And that is something which I think is missing in India, that we don't get that support from our government. While we are doing great work trying to sell globally, we had this funding grant opportunity where we were bidding for a grant, and it was between us and another country, one other country, and it was jointly funded by our government and the other government. And out of all the people that were applying for that, I think we were the only one which was building in India and providing support to the other country. And all the other potential grantees were that, from that country, products from that country or companies from that country providing services to India. And I said in that call that, I think we should look at us, because they said, okay, you're not bringing any benefit to India, why should we support you? And I was like, we have to promote our products to go abroad. If you don't promote, then we'll only be focused on India, right? Of course, there are lots of problems in India, but we have to promote our companies. And I think that's one thing which maybe is slightly lacking in India. But again, if you look at US and UK and all that, some of the more developed economies, they also don't do much. They're also very sort of democratic in that they provide support to all kinds of companies. But I think some of the other competitors that we have seen, they definitely have support from the governments in their countries. And I think that is something that we could do in India to help promote our companies to, especially, I think we are doing that a lot towards bringing products for the Indian market. But how do we support companies to even expand globally? How do we support them to go to a certain country? And is there some kind of a financial benefit that you can provide to go operate in a certain country? So that sort of building from India for the world is something that we have not incentivized too much yet.
So, it's interesting because there are a lot of incentives for, I think, manufacturing to go global. What you're suggesting is that there is an opportunity to apply the same kind of incentive structure or technology in healthcare to also go global from India.
Actually, that's a very, very good point. I was not thinking about it that way, but that's exactly, yeah. So I think we think about it from a manufacturing standpoint, that you want to get manufacturing to India, and then we want to obviously provide that to the world. But we can do that with high-tech technology also, not just limited to manufacturing. So I think that's...
Prashant, the other thing, and you mentioned this earlier, obviously critical to AI is data access. The quality of the solution is only as good as the data. Any thoughts on that? Where do you see the challenges and opportunities, both in India and other parts of the world?
So data is something where we are very lucky to be in India, because everything, we have it's a huge population. And if you look at even the average hospital, my brother used to be a doctor at CMC Vellore, and then he went to Singapore. He's working in Singapore now for the last 10 years. And CMC Vellore being one of the best hospitals in the country, right? And he was a junior doctor there, but he used to see so many patients with so many different kinds of disease areas, disease conditions. And in Singapore, obviously you're not seeing that, right? So I think that variety from which is not good, of course, but that variety that you see and the data that you have in a Indian hospital system, number of patients that you see in Indian hospital ecosystem is way higher than a lot of other countries. And so that is something which is good for us. I think for us, what we found is that when we started Qure, data is, for AI, data is key. Without data, you cannot build AI. People claim to build AI without data, but you have to have a lot of data to build good models. And we were fortunate because we could create partnerships with a lot of Indian organizations who had a lot of data. They could support us with a lot of data, and we could train on, for example, our chest X-ray product is trained on about 4 million scans now. And if you look at global competition, they are trained on much, maybe about 10x, even not even 10x, maybe like 100x lower sometimes, right? So it's a it's very tough to build a good solution with that kind of data. And we were actually very fortunate to start this out of India, where we had access to that kind of data. So that's a huge advantage that India has, and something that we should leverage, especially for AI products. And not only in healthcare, but in everything else. I mean, if you look at customer buying patterns or everything. I mean, I used to run a company which was in advertising technology before this. And even if you look at the amount of data that we had from what customers are buying, what customers are looking at, that data is far richer. I mean, we have got a lot more volumes of data than some of the more global organizations. So I think that's an opportunity that we should leverage, and creating policies around how data can be used, who's using the data, how do we actually build something around the data is something that we need to work a lot more on. I think our data laws are still sort of little bit archaic compared to like a GDPR that is there in the UK, that is there in Europe, and some of the other data laws in other countries. We need to figure out how to make those more robust.
And do you find that also affects competitiveness in some way or the other?
I think competitiveness is important. I think if competitiveness is something that is affected by data. Question is, who has access to data? That is the question, right? If you if everybody has access to the same data, then it becomes a commodity. If you have access to the data, then it becomes a differentiator. So definitely, I mean, I think data has been a differentiator for us for a long time. But yeah, I mean, we also understand that over time, other people will also get data, and they will also train good models, and they will have good solutions. So I think as an entrepreneur, what I have realized is that you have to keep on evolving your product, and your differentiator vis-a-vis competition has to keep on changing. I mean, in the first couple of years, it was maybe data that we had. In the next couple of years, it was the research and publications. Then it has to be regulatory clearances. Then it has to be actually the engineering and the access and the go-to-market. So I think it will keep on evolving, and over time, we will see, I mean, where that ends up in the next several years. But data is definitely a competitive advantage, and we should, I mean, for Indian companies, that is definitely there.
So Prashant, you bring me back to, I think, the first question you asked, which is the difference between the pharma industry and India Health Fund. And I'd like to ask you the same thing. Given, I think, the nature of the work that Qure.ai does, and I think the segments that you operate in, which is very much driven by public health systems in many cases, whether it's tuberculosis and now COVID, how do you balance out profit versus public good?
That's a great question. I don't think I have the answer to that, Madhav. I think it's a very, very tough question. But what I feel is that both have to be there together, because if you only rely on public money to be spent in a way where somebody is not profiting off of that, and then, I mean, you are not promoting innovation, right? In some ways, you're saying that, okay, there is all this money that we have as a government or as a public health organization globally, right? And we are going to give it to people who are only going to be non-profits, which is typically how it operates. You're not really promoting innovation, right? And I think that's one of the models that potentially I feel can change, because the reality is that people who are, I mean, capitalistic in nature, companies are capitalistic, right? And they are far more incentivized to innovate than a non-profit organization. And I think we have to figure out how to find the balance between non-profit and profit. And I think what we have seen at Qure is that we have never said that, okay, I mean, we are purely a philanthropic organization, or we'll build something which is going to be provided for free to our customers. We have never had that approach, but we said, okay, we are going to solve big problems. We're going to solve TB. We're going to try to solve COVID, lung cancer, stroke, trauma. And we have gone about I would say in a capitalistic way, building solutions which are being commercialized and being paid for by customers, but the value is created. And finally, point is that we are making the ecosystem better. We are making that ecosystem which was operating on subpar solutions better by providing a better quality solution. And that is where I think the private companies like Qure and a lot of other companies that you are funding at IHF and maybe others that are out there, right? They can come and add to this to see how we could work between the public sector organizations and the non-profit organizations and bring private sector in to innovate and to move quickly, because I think that's something which we have an advantage on. I mean, we can move much faster, and especially as not only as a private sector organization, also as a startup, right? We can move way faster than most big companies can, most NGOs can, and that is something where we can bring in that advantage and we can get stuff done much faster. So I don't know if there is a clear answer to the public good versus profit question. I think there has to be a happy medium somewhere, and we have to figure that out. But the point is that if innovation has to be there, then companies have to be incentivized. People have to be incentivized to innovate, and that incentive structure, if it's lacking, then we don't see good innovation happening.
And that obviously has an implication on the kind of capital that's available. Innovation.
Yeah, so that's again another point, right? If you look at capital, again, there are two types of capital that are available to a company like Qure, right? There is the venture capital and private equity money, which is capital to build the solutions and to grow it, which is obviously predicated on commercial success of the company. And there is capital which is coming from non-profit organizations which can help build our solutions. Now, the goals of both are very different, right? One is towards impact, one is towards capitalism, one is towards growing commercially. So I think it's a interesting, and I mean, till now, I think if you look at how we have typically done this, most of our capital has come from, I think venture capital, and that's sort of how we have grown till now. But I can also imagine building a company in this space where you're not taking venture capital money, you're basically getting funded by a non-profit or somebody who's doing that. And I don't know if that is the case, and if it's not if it's a non-commercial organization, I don't know how that would play out, and it might be a little bit different.
And in fact, that's exactly the relationship that we are now building between Qure.ai and India Health Fund, which as a not-for-profit is, I think, supporting the needs you have to develop the solution. But we're also working very closely to facilitate its adoption. And I think what we did with the municipal corporation in Bombay last year was a very good example of a public body adopting an AI-driven solution to, I think, bridge the gap that you mentioned in the limitation in the number of radiologists available to scan chest X-rays, to do a quick triaging of COVID patients. And the success rate was over 98% of asymptomatics being picked up, which I think manual screening was unable to pick. And then when they used it at the COVID care centers for patient monitoring, it suddenly freed up a lot of the doctors' times from routine monitoring because the algorithm took it over. And I think that is a great example of how that happy medium, as you mentioned, can be created.
I think that's absolutely true. Absolutely true.
The public authorities could see the difference that the solution was making, so they were open to adopting it. I mean, the Qure team obviously did an incredible job of, I think, facilitate. And India Health Fund sort of not just supported the development, but also worked with a number of other partners who provided the resources to enable the whole thing. And that's now, I think, becoming a virtuous cycle, which we're now working together on for wider scale up in more far-flung geographies, more limited areas. So as you say, it's a journey, but it's a journey that I'm very excited about working together on with the Qure team, because it's addressing a need that exists both in the public and private health sectors. And hopefully, I think, bringing really cutting-edge technology to the people who need it the most, and making sure that it's sustainable.
Let me ask you the same question back, right? How do you think, I mean, these private, and how do you promote innovation, right? I think we started with that question about promoting the vaccines and promoting innovation in this space, in the public health space for TB and HIV and malaria. How do we promote innovation? How do we bring the private companies, private startups to also build solutions in this area? And how do you sort of bring in public money towards doing that, right? And IHF is doing a great job of that, right? But how do you encourage that, I mean, at a global level to scale that up? And
Prashant, I think there are a couple of building blocks towards that. One is, of course, having a solution that can significantly improve outcomes vis-a-vis what's available. And we have a very tough focus on. If anything that comes to us does not provide a significant improvement over what's available, we do encourage, I think, a review, and we provide the technical support to help improve that. The second thing is building the financial case. How do those improved outcomes result in better patient outcomes? Not just patient outcomes, but I think overall health economics. Because sometimes you will see that a slightly higher cost of a test or a device can actually result in lower costs for the overall healthcare system in general, with better outcomes. So it also allows for better resource utilization without necessarily spending more money. So I think those are the two big buckets. And this is something that I think most public health systems are increasingly aware, very open to. And I have to say, I think certainly governments as well as the private sector are now increasingly understanding the need for this, not just for non-communicable diseases that they always have, but now for communicable diseases as well, because they're looking for, I think, the next best thing, which can help improve what is already happening on the ground, particularly for communicable diseases. And that's where our sweet spot is.
Got it. Got it. Do you anticipate moving on into non-communicable diseases at some point, or this is communicable diseases is going to be your focus for next several years?
So like I said, what we are doing is really supporting the development of technologies which can be applied across several diseases. So in many cases, the technologies we are supporting already are applicable to between communicable and non-communicable diseases, Qure being a great case in point, where I think what we started with TB has now also been applied very successfully for lung cancer. So as these solutions evolve and as these solutions emerge, we will continue to facilitate them because we're very keen on supporting technology-driven platforms, which can be applied across several diseases, which I think help us fulfill our goal of impact, but also ensure that we're very capital efficient in doing it. We can obviously address, we can impact a larger number of lives. As an organization, we are very focused at the moment on, I think, helping meet both the national as well as international goals of elimination of communicable diseases by 2030. And in the case of India, 2025 and 2027. Beyond that, if all goes well, once these are eliminated, will there be other communicable diseases to deal with? I'm sure there will. Will non-communicable diseases go away? Sadly not. So I think it's going to be a journey that we will take. We're already, I think, at the very early stages of at least ensuring the crossover from communicable to non-communicable diseases. And I think that will continue over time.
And I mean, what would be your advice to entrepreneurs who are starting out in this area? I mean, in general, if you were to advise an entrepreneur starting out in healthcare, what would be advised in terms of maybe talking about what areas they should focus on, what geographies they should focus on, and so maybe just, and maybe in general, Gyan also on how entrepreneurs should build a company in this space. You have seen so many entrepreneurs working in the public health space, right? So maybe you can give advice to some of the other entrepreneurs who are coming up.
So I think the first piece of, possibly the only piece of advice I would give is look beyond the science. See how the science is applicable to the market. And I think that's very often where great solutions don't really see the light of day because they haven't necessarily adapted to the needs of the market, whether it's the public health system or the private health system. And there is very often an adaptation that's needed because that's where scalability eventually happens. I think that would be the first thing. The second thing would be, and this is something we spoke about earlier, think global always, because the world needs these solutions. And I think thinking global allows for, I think, a certain approach, which you've, I think, articulated so eloquently in terms of understanding the regulatory requirements, the geographical requirements, and the other, obviously, the capital requirements. And I think the third thing would be engage early with a number of stakeholders, which would involve not just, I think, the regulators, but also possibly the distribution and channel partners, the hospitals and the health systems that would be the end users, to make sure that the design requirements are taken into account early rather than at a later stage when possibly a solution is well developed. So I think those would be the three things I would say. There's no magic bullet, as you know.
And any last words for from an IHF perspective on our partnership and anything we could be doing together?
So look, I think the IHF Qure.ai partnership has been an incredibly fruitful one and a very fulfilling one, certainly for both partners. I think there is a lot that we can do together because if you think about it, we're at the very beginning of a journey and we've built a solution together. we have started developing the stakeholder relationships to, I think, demonstrate the ability of this solution to have an impact. Now, whether it's been in a city or now increasingly in certain states in the country. That's all been done with catalytic funding. I think the opportunity we now have is to collaborate on demonstrating both the impact at a patient level as well as, I think, at a resource level the deployment of this solution can have on a larger scale, with the intention of, I think, almost evangelizing adoption across the world, and also facilitating, I think, the resources that are needed to support both the adoption as well as the further development of this, because, I mean, technology runs on a very quick turnaround cycle and the development cycle. So I think there is the opportunity to also continuously evolve. And I think that those would be, I think, very fertile areas for India Health Fund and Qure.ai to continue collaborating, as also to see how AI-driven solutions in general can be facilitated by, certainly by India Health Fund and possibly many of our other partners and collaborators, so that we can create a whole ecosystem of technology improving outcomes in healthcare.
Thank you, Madhav. That was very enlightening, and we really appreciate the partnership with IHF from the ability for us to expand our solution portfolio, to expand beyond just digital X-rays to analog X-rays as well, but also the ecosystem support that you have provided from Connects to BMC to other customers across the country, and that facilitation of that expansion, adoption. Those are all things that are hard. And I think, as you said, I mean, we are in the early stages of this partnership and gradually expanding the outreach and gradually expanding how we deploy at more places and finally, the goal is to create more impact together. So looking forward to a very strong partnership and continuing to strengthen our relationship going forward. And thank you so much for your time today. It was an honor chatting with you, and thanks for all your advice and guidance over the years and today as well, and look forward to being in touch.
Likewise, Prashant. Thank you for your time. Thank you for having me. And it's been a great partnership. Look forward to continuing to build and strengthen it.
Thank you. Thank you.
Thanks very much.